Hello and welcome to our video series, Treatment Acceptance Mastery for the New Patient Experience and Treatment Acceptance. I'm Dr. Paul Homoly. This video series is specifically designed for dentists and team members who seek to evolve their practices toward providing more complete care, including implant dentistry, cosmetic dentistry, aligner orthodontics, and restorative dentistry. Its topics will focus on critical distinctions within the practice of dentistry. Once understood and implemented, these distinctions will favorably distinguish your practice in the minds of your patients. This lesson's distinction is between education versus disclosure. Every dentist and team member learned early in their career the mandatory routine of educating patients. In school, we learned a popular adage, inform before you perform, which was sage advice for student dentists with less than steady hands. Patient education is an essential component of preventative dentistry. We educate our patients on preventing dental disease and home care techniques. Patient education is also fundamental to informed consent. Patients need to know the benefits, risks, and alternatives to care. However, despite the crucial nature of patient education to prevention and consent, patient education is highly overrated as an element of influence. Think about it. Have you ever had a patient whom you thoroughly educated about their conditions, causative factors, treatment options, and consent issues, and have them not accept your treatment recommendations? I bet it may be happening to you every day. Treatment acceptance, especially for patients with complex care needs, requires far more than patient education. Many complex care patients need more inspiration than education. They need to be inspired by the hope of dental care providing abundant lifestyle benefits. They need to be confident the right dentist is treating them. In many ways, patients' significant decisions about accepting care is more about choosing the right dentist and less about the dentistry. The concept of disclosure gives patients substance that builds their confidence in their dentist. Disclosure is revealing to patients your life roles other than being a dentist. Revealing your role as a husband or wife, or son or daughter, or parent, athlete, musician, or ballroom dancer, or any role other than your dentist role allows patients to see a bit of you in themselves. A common mistake dentists make is not revealing their personal side. Let them know a bit of your life outside the dental office. It's like giving them a keyhole to look through to see who you are. Dental care is personal to patients. They want it to be personal to you too. To bring disclosure into the new patient interview is simple. Just get curious about your new patient's family or their work or their current events. As they share about their life, share a bit about yours. You don't need to go deep or long into your disclosure. You'll find a little disclosure goes a long way in making patients' initial appointments feel personal. Also, as patients disclose about their personal life, listen well. Within their disclosure often will be significant life circumstances that affect their readiness for care, especially complex care. It may be they have children in college or starting a business or have significant travel plans. An excellent strategy is to preface your treatment presentation by revisiting their significant life events. Doing so gives patients a sense of acknowledgement of what's going on in their lives. This is especially critical for high-fee, complex patients. Treatment acceptance, especially for complex care patients, is more about patients choosing the right dentist and less about the dentistry. Disclosure gives your patients good reasons to choose you. When it becomes critical that your practice better fulfills its vision of providing excellent new patient experiences, and improve treatment acceptance, my work becomes the perfect companion to fulfill that vision. When you're ready to discover more, consider visiting Treatment Acceptance Mastery. Thanks for listening.